Welcome to This Explainer. Today, we're doing something really fascinating. We're taking a step-by-step journey deep into the microscopic world of our own bodies to demystify cancer biology. Now look, we hear the word cancer all the time, and it naturally carries a really heavy emotional weight. But today, we're going to put the fear aside. We're going to look at it objectively, purely through the lens of science. Because here's the thing, by understanding exactly how it starts, how it grows, and how it behaves, we can literally transform a terrifying mystery into a comprehensible process. Let's uncover this together.
Here's our quick roadmap for today. We'll start with number 1, when cells stop listening. Number 2, how cancer tumors grow. 3, invading and spreading. 4, why cancer can return. And finally, number 5, remission versus cure. All right, let's jump right in.
Part 1, when cells stop listening. Our bodies are made up of trillions of cells. Trillions. It's kind of mind-boggling when you stop to think about it. And inside the nucleus of every single one of those cells is DNA. You can basically think of your DNA as the ultimate instruction manual. It's packed with genes that tell a cell exactly what to do. It tells it when to grow, when to go to work, when to divide, and crucially, it tells it when it's time to die. Now, as long as our cells follow this instruction manual, we stay healthy, and the whole system runs smoothly. But there's a pretty stark contrast between normal cell behavior and cancer cell behavior. Normal cells are the ultimate rule followers. They divide only when they're explicitly told to, and they mature properly to do their specific jobs. But what happens when that DNA gets damaged? Those genes mutate. Suddenly, the instruction manual is completely mixed up. The cell goes rogue. A cancer cell just doesn't act like a normal cell anymore. It completely stops listening to the rules and starts dividing and growing wildly out of control, even when the body doesn't need it to. To truly wrap our heads around how chaotic cancer growth is, we first have to remember what normal cell division is supposed to look like. When your genes are working perfectly, they only trigger a cell to divide when your body actually needs it, like to replace an aging cell or heal a cut. And it is this beautifully orderly, exponential process. One cell divides to make 2 exact copies, those 2 become 4, 4 become 8, and so on. It is tightly regulated and perfectly balanced. So how exactly does the instruction manual get corrupted in the first place? Well, gene damage generally happens through a few specific pathways. Sometimes, mutations are just inherited from our parents. Other times, they happen naturally, simply because we're aging and our genes basically experience wear and tear over time. And then, of course, there are environmental factors. These are things we interact with daily: cigarette smoke, alcohol, or even UV radiation from being out in the sun. These common interactions can be the very sparks that mutate a healthy cell into a cancer cell. Moving on to part 2, how cancer tumors grow. Once you have a group of these rogue cells together, they start exhibiting some really unique rule-breaking behaviors to survive. Simply put, cancer cells are troublemakers. They divide incessantly. They stay totally immature, meaning they never actually grow up to do a useful job for the body. They're sneaky, actively dodging the immune system. They completely ignore any signals telling them to stop dividing, and interestingly, they don't even stick together very well, which is a detail that becomes absolutely crucial later on. Ultimately, as they accumulate, they just grow into and damage the surrounding tissues. Now, as this mass of troublemakers divides, a tumor forms. And just like any normal cell, cancer cells need oxygen and nutrients to stay alive. When a tumor is tiny, it can easily just grab what it needs from nearby blood vessels. But as it gets bigger, it gets much hungrier. So incredibly, the tumor starts sending out signals to literally build brand new blood vessels directly into itself. The medical term for this is angiogenesis, which sounds super intimidating, but think of it as just a mechanical plumbing process. The tumor is literally hacking the body's infrastructure to feed itself. But here is where we find some incredible scientific hope. Because researchers understand this exact plumbing process, they've been able to develop highly targeted treatments. There are drugs called angiogenesis inhibitors, and they are designed to specifically block that blood vessel growth. If you can cut off the tumor's food and oxygen supply, you can force it to stop growing entirely, and in some cases, you can actually make it shrink. It's amazing. By understanding the biology, doctors can literally cut the problem off at its source. Which brings us to part 3, invading and spreading. As a tumor gets larger, there are 2 primary ways it starts encroaching on the rest of the body. The first is what we call local invasion. This is when the growing tumor physically bulldozes into the normal tissue right next to it. To do this, the cancer cells actually pump out enzymes that break down the normal, healthy cells standing in their way. But the second method is much broader, and it happens when cells break away entirely, rather than just pushing outward. This introduces a word that is often really feared, but one we need to clearly demystify: metastasis. The crucial thing to understand here is that metastasis simply means that cancer cells have detached from the original tumor, slipped into those newly built blood vessels or the lymphatic system, and essentially gone on a road trip. They're using the body's highways to travel to a completely new location and start that chaotic growth process all over again. Once we demystify the term, it's a little less scary. They're just traveling cells. And here's an interesting fact. These traveling cells don't just randomly land anywhere. Cancer is actually surprisingly predictable. Depending on where the cancer started, it has favorite destinations it likes to spread to. The most common locations are the lymph nodes, the bones, the brain, the liver, and the lungs. And because scientists and doctors know this, they can use this predictable behavior to their absolute advantage when they are scanning a patient's body. In fact, mapping this spread is exactly how doctors determine a cancer's stage. When you hear a doctor talk about stage 1 through stage 4, usually written in Roman numerals, they are directly referencing this spread. By figuring out where the cancer started and then checking those predictable common locations to see if it metastasized, doctors classify it. And understanding this stage is exactly how the medical team puts together the most effective, personalized plan for treatment and supportive care.
Part 4. Why cancer can return. So, why does cancer sometimes come back? It's a question that carries a ton of anxiety for sure. But if we lean into the biological explanation, it really helps us understand the why behind it all. When cancer returns, it's called a recurrence. And biologically speaking, it is basically an issue of pure math and exponential growth. Remember earlier when we talked about one cell becoming 2 and 2 becoming 4? Well, if a patient goes through treatment, let's say they have surgery to remove a tumor, if even a single microscopic cancer cell is left behind, that one cell can restart the whole process. It can divide and grow into a brand new tumor, either right in the original spot or in a new location if it had already traveled. Because doctors know that all it takes is one rogue cell to cause a recurrence, they've developed preventative cleanup strategies. This is known as adjuvant therapy. It's essentially an extra treatment, like doing a round of chemotherapy immediately after a tumor is surgically removed. The whole goal of adjuvant therapy is to sweep through the body and destroy any of those invisible left-behind rogue cells, stopping them before they can ever start dividing again. However, there is another reason cancer can start growing again, and that is treatment resistance. Because cancer cell genes are so unstable, they can actually continue to mutate even while treatment is happening, effectively building a shield for themselves. Sometimes a brand new mutation pops up that makes the cell totally resistant to a chemotherapy drug that was previously working perfectly. If the cancer stops shrinking because it's become resistant, the doctors will just pivot. They'll try a different treatment path to try and outsmart those new mutations. Finally, Part 5. Remission versus cure. There is a really vital distinction in the medical world between being cured and being in remission. Now, many cancers absolutely can be cured, but doctors are incredibly careful with that specific word because, as we just learned, a single microscopic cell hiding in the body can cause a recurrence even years down the road. So many medical professionals prefer to use the term remission to more accurately reflect the scientific reality of the disease. Just to give you the official framing from the source material, remission means there are fewer signs and symptoms of a disease or that they have completely gone away. This framing is absolutely brilliant because it offers so much clarity. It allows us to celebrate a highly successful outcome where a patient feels healthy and symptom-free, while simultaneously being responsible and managing expectations about the need for continued monitoring. We have covered an incredible amount of ground today by walking step by step through this biological timeline, from a single broken instruction manual to the ways these cells divide, build their own blood vessels, travel, and respond to treatment. We completely strip away the mystery. Cancer is wildly complex, yes, but it isn't magic. It's just biology. And understanding that biology empowers us with knowledge rather than overwhelming us with fear. It lets us see exactly how science is fighting back at every single stage of the game. Which leaves us with one final provocative thought to ponder. As our medical technology gets better and better at reading the intricate instruction manuals inside ourselves, how close are we to a future where we can correct those rogue instructions before a tumor ever even forms? Keep learning, stay curious, and thank you so much for joining me on this explainer.